Flashpoint, the voice of national unity. And I'm David Cote. We're here on every Friday, beginning from 10:30 to 11:30 with the program Flashpoint. And today, I have a special guest in studio again, as usual. It's always medical people. Once in a while, we're bringing some politicians, but today we're doing medical again. Dr. Marlay Reed has been on my program before, one or two times. That's more than 5-6 years ago. And she's the CMO, that is Chief Medical Officer of the New Hope Clinic. And she's here with Mrs. Reed, who is the administrator. Also, Mrs. Reed, she's been here 1,000 times, and she's here again. And those of you who may be wondering why we bring people here from the New Hope Clinic most of the time, according to the Chinese, acupuncture treats over 300 illnesses. But the WHO recognizes 47 illnesses that acupuncture treats very well. So if the World Health Organization can recognize 47 illnesses, then it means that acupuncture is truly something that we should go by. Welcome to Flashpoint again.
Thank you for having me.
Right. I use the word again because you've been here before, I think 2 times.
Yes.
We were at the old building there.
Yeah.
Thank you. Now, Mrs. Reed, this is your home. Welcome again.
Thank you. Thank you.
Yeah. You're always ready when I call on you. Thank you. We want you to please start first of all, Mrs. Reed, Marlay Reed, Dr. Marlay Reed, not Mrs. Even if you have that Mrs. there, we'll prefer calling you Dr. Marlay Reed. Please introduce yourself and also tell us a little bit about your trip to America. You have been away for a little while.
Okay. I'm Dr. Marlay Reed. I'm the CMO of the New Hope Rehabilitation Fitness and Health Center. And we are located in Painesville, so clinic to be precise. That clinic been around for a good while now. Mm-hmm. And I've been the CMO there.
I can help to tell the good while. It's been around since 1998.
Yes.
When you were in Oro, Cape Town.
Yes,
yeah.
That's true. Mm-hmm. And I've been away for some time, even though been coming back, but I haven't been stationed here.
Yeah.
For some time, I've been away in the U.S. I have a growing family, so I've been taking some time out for the family and also been trying to do some refresher programs, health-wise,
okay,
related to the clinic
right.
and acupuncture and what I do.
Okay.
And also been trying to see if I can do some solicitation for the clinic.
Right.
I bring benefit directly to the clinic.
Okay.
Yeah. So I've been away for a while, in and out.
Yeah.
And the good thing is I have really good trained staff.
Yeah.
That have been running the clinic very effectively.
We're going to come to the structure. I know. We're going to come to that. Just introduce yourself first and give us some details about your trip to the United States. I mean, we'll come to that.
Yeah, so so pretty much that's it. I've been away. I've done some refresher courses. I've been paying attention to family. Mm-hmm. But it's good that I'm back. And It's really good to be back.
Thank you. Welcome back.
Thank you.
Now, Mrs. Reed, I know you're a proud mother today, sitting by your own daughter, your born daughter, who is now a medical doctor. Your husband, Dr. John Reed, established a New Hope Clinic in 1998 when you were in the old role there where you saved so many lives. And then, after his passing, you took over. Your daughter also took over. You went to China for training and so on. But then, you are sitting by your daughter today. Please tell us a little bit about yourself also before we go to the main issue. She's the one doing most of my talking here today, not you. So I want Dr. Reed to talk mostly here today, but please tell us a little bit about yourself also.
Thank you. You used to call me Dr. Reed, and I told you, say no, I was not Dr. Reed, I was Mrs. Reed.
Right.
And today, the main acupuncture doctor, Dr. Reed, is in studio today,
right.
Dr. Marlay Reed.
Mm-hmm.
But I'm Mrs. Helen Reed. I hail from Nima County, and then I'm a BSc RN and also an acupuncture nurse. I did acupuncture nursing in China, and I'm the administrator, stroke the clinician for New Hope Clinic.
Okay. Well, thank you. Dr. Reed?
I'm also a Reverend.
Oh, all right. Yeah.
I'm also a Reverend.
Yeah.
I have a prayer ministry.
Mhm.
I have a church. So, yeah, we are serving God and serving humanity.
All right. Thank you. Dr. Marlay, our main topic today is stroke, one of the most serious problems around the world today.
Mm-hmm.
Millions of people have died from stroke. Millions of people are permanently disabled today. What is stroke?
Okay, so I'm going to try to break it down in
Yeah.
the simplest possible form.
Mm-hmm.
So there are two main type of stroke.
Mm-hmm.
We got one we call the ischemic stroke,
Right.
which is just a medical term, but it actually means like a clot or
Okay.
a blockage to an artery in the brain.
Oh, okay.
Yeah, that's one of the most common type of stroke that you will find.
Okay.
So that means the brain has a clot or there's a blockage to one of the vessel in there, so
Mm-hmm.
it lost oxygen for a few minutes, so it don't function properly.
Okay.
Okay, that's like the layman
Yeah. It's a very clear.
interpretation.
Yeah.
And then we have the second type of stroke,
Mm.
which is the hemorrhagic stroke. That's like the bleeding
Okay.
type of stroke. So where you have a leakage
Mm.
or a burst in the
In the brain.
So you have blood leakage there.
Mm.
It leads to stroke also,
Okay.
and that's the second type of stroke.
Okay.
And stroke,
Can I safely say stroke is also called brain attack?
yeah, but it actually can be an accident.
Yeah. Okay.
Yeah, so there are so many reasons why it happened.
Okay.
So there are so many reasons why there will be bleeding in the brain,
In the brain.
or there are so many reasons why there will be, a blocked
Okay.
in the brain
Okay.
artery. But I mean, those are the two main strokes that you will find
Okay.
that are very common.
Okay.
Okay, and stroke itself is a medical emergency.
Hmm.
So if you feel like you're having a stroke, if you sense that somebody that you're taking care of, somebody beside you is having a stroke, you call 911. So, I mean, that's just like a medical emergency.
Yeah.
So you have to take the person directly to the hospital as soon as you can and as fast as you can.
Okay.
Yeah. And you have to go to the hospital immediately, and there are common signs
Yeah.
and symptoms.
You
like-
answered my next question. Go ahead with it.
that-
What are those signs and symptoms? You know, some people sitting at homes,
Mhm,
they have certain trouble and they don't know what is happening to them.
mhm,
So, what should we see happening to us, or what should people observe
mhm.
and know that they are about to develop stroke, and they should run to the hospital quickly? What are the signs and symptoms?
Okay, so we'll talk about the most common signs and symptoms of stroke. So one will be sluggish speech
Hmm.
or slurred speech. That means the person,
Mm.
like you start to speak very slowly, or like your tongue is not
Yeah.
working properly. So
Okay.
you know how somebody normally
Yeah.
talk, and
Yeah.
then you see them having a
Difficulty
very slur,
speaking. Yeah.
thank you, difficulty to speak or pronounce words or
Mhm.
trying to communicate with you.
All right.
That can be one sign. Another one can be what we call a drop face.
Hmm.
So you see like one side of the face feel like it's twisted,
Yeah. Oh. Okay.
or your mouth is
Yeah.
kinda,
Yeah. Mouth twisted.
yeah. Some people can have drooling, like they want to say something and spit's coming out of their mouth,
Ah.
or they can't chew properly.
Oh, okay.
Yeah, when they smile, you see that the mouth is twisted to one side of the face.
Yeah.
Yeah, that's another sign.
Okay.
And another one is weakness
Hmm.
or numbness
Yes.
in both extremities. So it could be your right or it could be your left.
Mhm.
So, for example, your left arm is not working properly.
Hmm.
You can hold something. You try to hold your phone,
It will drop.
it drops.
Mhm.
You try to hold something to stand up. You can't get a grip. There's severe numbness or weakness. It's not working properly. It's either it affects either your left side
Mhm.
or your right side. So it's gonna, if it's attacking, it's gonna attack your right arm. If it's your right side, it's going to be the arm and the leg
Okay.
on that side.
Hmm.
If it's your left side, it's going to be the same thing. So if you see somebody left arm and the leg having, severe weakness,
Mhm.
they're not able to move, they're not able to walk properly,
Yeah.
yes, you want to take them to the hospital
Very quickly.
very quickly. So that can be, a headache, severe headache.
Yeah, before we go to the headache, we who are the lay people who are not medical doctors, we see
Mhm.
people having those problems,
Mhm.
and we conclude, we say the person wants to die.
Yes.
Yeah, so you are the medical people. The person wants to will not die, but there'll be a problem.
There'll be a problem.
All right.
Yeah.
Okay.
So that you should know that this person might be having a stroke.
Okay.
And then some people we have like very, very sudden,
Mhm.
severe headache.
Hmm.
You might want to rush them to the hospital
Okay.
to know that maybe a stroke is occurring. Some people will have blur vision. You can't see in one side of the eye.
Huh.
Yeah, you just can't see in one side of your eyes. You might want to rush to a hospital to know that.
Might
Might
want
be.
to, or you must rush
You
there.
must rush to a hospital.
Yes.
It is. I keep telling people that stroke is a medical emergency.
Okay.
So once you have the symptom, you have to go to a hospital
Immediately.
because it can be life threatening.
Yeah. Which means you can die from it.
Yes.
When she says life-threatening, it means that you can die from it. Can stroke lead to coma also? Coma.
Yeah. So there are what we call complications of stroke. So the stroke actually, like I told you, the first step of stroke, there's loss of oxygen to the brain. Few
Yes.
seconds.
That's the ischemic stroke.
Yeah.
Mhm.
Few seconds, and that part of the brain will start working again. But the damage that when it stops working, the human brain is like it has to be working constantly because it needs communication for other parts of the body to function.
Right.
So few seconds can be dangerous.
Hmm.
So few seconds, somebody arm, the leg, the speech, everything is gone.
Hmm. Because
And
no
then-
communication.
Yeah, and then if it starts to work again, but that complication has already occurred. So most of the time, people will be treating the complications of the stroke that has happened.
Yeah. My goodness.
Mhm.
Are there other symptoms and signs? You reminded when you talk about people's mind being twisted. I'm reminded of one Mr. Riley who was at your clinic at the time you were in the States. Man went to work one day. He was a big man at the FDA. He started saying, I'm feeling some numbness on the face. Out of a sudden, the mouth just twisted on one side. When he went to your clinic and got treated, he was there for a few weeks. He called me and said he wanted to appear on my program to tell God thank you. He's a pastor. Yeah. So he was here. So are there any other signs?
Yeah, those are the major ones. You have the speech. Some people have memory loss.
Uh-huh.
You
You can't remember.
You can remember. And then some people will lose consciousness, like you were saying.
Yeah.
Yeah, they will lose consciousness. And you have very limited to no movement in one side of the extremities.
And what?
Both extremities, actually.
Okay.
Either the arm and the leg
Yeah.
of the right side or the arm and the leg
the
of the
side.
left side. Yeah.
What if you're walking and stumbling, maybe you're walking like one drunkard?
Yes.
Is that one of the signs too?
Yeah, that's one of the signs.
And this is where people have to be careful.
Yeah.
When you notice that, make sure you are closer to a wall or a table or something. Because when you fall, it's serious.
Yeah. Even if you don't fall, you can still be serious.
Okay.
Yeah. You can be sitting and having a stroke and it's still serious. The only reason you want to prevent somebody from falling because you don't want injury.
Injury.
Yes.
Now, what are the risk factors? We are doing a lot of things today and we don't know those things are leading to problems. What are those things that people do that they must stop doing or else there'll be a problem?
So we have, I would just like do two categories of risk factors. So let's talk about the medical risk factor.
Mm-hmm.
So there are certain medical conditions that will put you at a higher risk
Okay.
for developing the stroke.
Mm-hmm.
So, for example, high blood pressure.
Ah.
Somebody that has uncontrolled high blood pressure. That's the word.
Yeah.
Because high blood pressure is not something that can be cured,
Hmm.
but it can be controlled.
Control.
Yes. So if you have a high blood pressure that is being controlled, your chances of having a stroke goes down.
Okay.
If you have a high blood pressure that is not being controlled, that is uncontrolled, your risk of having a stroke goes all the way up.
Okay.
So that's one medical, factor that leads to stroke. Another one is diabetes. Uncontrolled
Blood sugar.
blood sugar. So if you are diabetic, and your diabetes is not under control, that means you're not taking the medication, you're not eating properly. That can also lead to stroke.
Mm-hmm.
People that have family history
Ah.
of stroke,
Okay.
they are high risk.
Okay.
Somebody, so if your dad has stroke or your mom has stroke, you are a higher risk than somebody who
Yeah.
parents have not had stroke. People with cardiovascular diseases.
Hey, that's heart disease.
Yes. So people that have, underlying heart disease are a higher risk to develop stroke.
Okay.
So that's the medical risk factor.
Yeah.
So those people are a higher risk. So if you have a high blood pressure that is not under control, you are a higher risk. So you want to, if you have any of these medical conditions, you want to make sure that they are under control.
And the bad thing is that most people don't care to do any checkup to know what is happening to them in this country. So if you have high blood pressure and you don't know you have it, it can result or lead to stroke. So the first advice Dr. Marlay Reid is giving here is that always know your status. So that if you have high blood pressure, it will not be cured, but it can be put under control.
Yes.
If you have diabetes, the same thing. Let's talk about acupuncture. Now, how is acupuncture administered? I've seen needles all over people's bodies. Is it painful, and how is it administered?
Okay, so acupuncture is an Asian form of Chinese treatment that treats nerves. So that's the whole idea of acupuncture. So acupuncture, all the needles you see on the body, they are placed specifically to nerve endings in the body. So we call acupoints.
Acupoints, okay.
Yeah. So the needles are placed to specific acupoints on your body. They are not just placed randomly, and they are not just random needles.
No.
So they are placed to specific points on your body. So you have to be a trained acupuncturist, and you have to have some training to know what are the acupoints for different conditions, for different health conditions that you will be able to treat properly.
Yes.
You have to know the degree at which you have to put the needles for different conditions,
Right.
and different points.
Okay.
You have to know the length. I mean, it's a whole science about it.
Yeah.
But that's the whole idea of acupuncture.
Right.
So these needles are placed to specific nerve ending points or specific acupoints that treat or that stimulate and regulate your body to treat it.
Let me just throw small light. If a man is suffering from sexual weakness, you are telling us that there is a place that you need to put a needle to treat that case.
Yes.
If a person is suffering from migraine headache, that is serious headache on one side of the head,
There are
there's
specific acupoints
to put the
treat.
needle.
Yes.
If a person is suffering from lumbago, for example, lower back pain, there's a place to. That's what you try to tell the public.
Yes.
So you have to be trained.
You have to be trained to
As
be
an
able to
right.
administer acupuncture.
Hmm.
Yeah. There are specific acupoints on the body
Yeah.
for every condition.
Mrs. Reed,
Yeah.
Even though I asked you to just be here to escort your daughter, but I will ask you one thing, but she will do most of my talking today. While you're here, please tell the public some of the illnesses that acupuncture can treat successfully. But before you answer that, let's tell the public that this is Flashpoint, the voice of national unity. And I'm David Coty. We are here on ELBC 99.9. We're very grateful to the management of this station for allowing us to be here to do our program. It's on every Friday. And we bring in medical doctors, sometimes politicians, but majority of my people are medical doctors. Mrs. Reed, what are some of those illnesses you treat there? I can't just have you sitting here, you're going to talk small. Yes.
At New Hope Clinic, we treat a lot of conditions that are common in Liberia, like hypertension, stroke that you are discussing, arthritis, rheumatism, spine injury, migraine headache, lumbago, and many others. Sexual weakness or sexual dysfunction, anyway, and many others that acupuncture can treat successfully.
Yeah.
And at New Hope, we treat illnesses like PAR.
Yeah, that's another major problem.
Like PAR, which is hemorrhoid.
Yeah.
Commonly we call it PAR in that area.
Yeah.
And stomach ulcer. Yes, and the like.
And the like.
Yeah, those are conditions that we can treat with acupuncture successfully. Like the chief said, all those conditions have specific nerve points that you can put, you can install, you insert the needles.
Yes.
A matter of fact, the nerve points are many, but you pick the ones that you are treating, the illness that you are treating or the conditions that you are treating, you pick the nerve point to use.
Okay. We may come back to you, but let's come back to the chief for today. Tell me a little bit about the structure of your clinic. When people hear about New Hope, some people have been there, they know the structure, how it is laid out. But tell me about the structure a little bit for people who have not been there before.
So New Hope Clinic, like I said, is located in the Painesville Soul Clinic community, and it's a facility that we run. It's a 24-hour health center, and we do both inpatient and outpatient. So we have 12. It has a capacity to take 12 inpatient at a time.
Yeah.
And it's a full medical facility. We have a laboratory that we do a full, blood chemistry. We have a pharmacy that is there that we, when we prescribe medications, you also get it from our pharmacy that we have. And we have the inpatient side of the clinic where we keep people, where we admit patients to monitor them, we feed them, we provide, breakfast, lunch, dinner. And we also have the outpatient where you come, you see the doctor, you take treatment, you go home. We have that side of the clinic. We are trying to bring more physiotherapy machines.
Okay.
Because most of 75% of the patients that we have are stroke complication of stroke.
Okay.
So they also need their rehabilitation. And we have a little bit of the machines there, but not many. So we're working to bring in more of it. Yeah.
How effective is your laboratory?
The lab is very effective because we do a lot of blood work. We do the routine, and then we also do a blood chemistry.
Okay.
Yeah.
You'd like to tell the public some of those laboratory tests that you do?
Oh, okay. So it depends on the condition, but usually we'll do the routine. We check for the sugar, we'll check your blood level, we'll check like your hemoglobin, we'll check your urine, we'll check for common things like malaria, typhoid, we'll check for cholesterol.
Mm-hmm.
We want to make sure we check.
So no guessing work.
No guessing work. We do lab.
So if
So
I come,
every patient, even if you're admitted or you are an outpatient, we do laboratory work for you. We do a routine lab. That's a whole package. You come, you see the doctor. We have to do blood work before we can start treating, because we're going to be prescribing medication
right?
for you. So
You need to know the case,
yes, we need to know.
Mrs. Reed, I'll come back to you. You will not talk too much here, but you got to answer this one. Are you very expensive? How much do you charge for a particular treatment? Let's take, for example, somebody has lumbago, lower back pain, which is a serious problem in most offices, because people sit too long for hours, and that can cause back pain. What do you charge, for example, for back pain to be treated?
You see, we got what we call individual differences when it comes to treatment. So it's difficult to sit on the air and say how much we charge for this, because it's not like if you are going in a store to pick up and acting. When you come, when we do the assessment and we do the laboratory is also done according to what you present, according to what we want to know, what we want to find out. So that's on based on that, then we charge how much you pay for the lab. And for the treatment, what we order is what we pay. So sometimes two persons will come, one person, two of them got stroke, but they don't take exactly the same medication, they don't pay the same bill, because some people, maybe your stroke, like you said, the complication, maybe your stroke is developed from hypertension, maybe the other person's stroke developed from blood sugar, high blood sugar, which is diabetes. So therefore the medications will not be the same. So the charges will not be the same. So surely we charge according to the patient's condition and what the treatment.
Somebody may be listening all the way there in Kakata, and they have some of the problems you're talking about. What should they put in their pocket initially?
Initially, what I know is that generally registration is $15, 15 USD, or it's equivalent in Liberian dollars.
But they say you don't take Liberian dollars.
No, I say it's equivalent in Liberian dollars for registration and consultation.
Yeah.
Once you pay that $15, they will write your name down, they fix a chart for you, the doctor will see you, or the clinician, whoever in charge will see you, and everything.
Okay.
That is what I know. That is something that it should be done. But when it comes to, which is constant, but when it comes to the treatment, then it's difficult to say how much you will pay when you get Marlay.
The case has to be diagnosed first.
Yeah.
What would you like to add, Dr. Reed?
Yes, so
With you can't say, don't call me doctor. You're a full doctor. Mrs. Reed has been saving lives over there.
yes.
People got problems, go to many places, no hope. When they get there, they get new hope, and they are treated. Then when I said Dr. Reed, she said, I'm not a doctor. I don't understand that. Anyway, since you have the degree as a doctor, we feel free to call you doctor. Dr. Reed, what do you want to add?
So, like she said, treatment are individualized. So it's not one package. It's not one, fit all. So it depends, what you come with. Your treatment is going to be tailored to your need, to what the diagnose. What do you need? What do you need to focus on? What do you need to control? And everything. So all the treatments are individualized.
Okay.
Yeah.
Well, let me inform the public now that we'll soon be taking a short break, and after the break, we'll open the line so that you can participate by asking some questions to Dr. Reed Miller. She's here today to talk to you. The numbers you're going to be calling to talk to the doctors here will be 0777 511 977 or 0886 511 977. 0777 511 977 or 0886 511 977. When you call those numbers, you will get the doctor and they will respond to your concerns. Let's take a short break.
Water brings life. Life is water. John the pure, refreshing